Hi, everybody. Dr. Alicia Gajar here, and I just have to share with you that I had a patient leave my office just a few minutes ago, and there are at least 5 different facts about perimenopause and menopause that I need to inform nearly every patient about. Nearly everyone I meet with, there are just these misconceptions and sort of lapses in knowledge. And it's not the patient's fault, right? It's a lack of information from the medical establishment, from our modern healthcare system. I just want to share with you these 5 facts that I wish every woman knew about perimenopause and menopause. So, first of all, I need you to know that, yes, you may have heard that menopause is the cessation of your menstrual cycle and thus the end of fertility. Yes, that is true. But did you know that it can take up to 10 years of transition time to get there? And by transition time, I mean you may be in a state called perimenopause for years. During that time, there can be a lot of unpleasant symptoms. And you may feel like you are totally losing your mind, especially if you've been dismissed, unfortunately, by your healthcare provider. But what I want you to know is that you are not losing your mind. It's not all in your head. And the perimenopause transition can last quite a long time. If you don't feel like you're being supported by your physician during this time, please get a second opinion. Number 2, when we think about menopause and hormones, we're thinking about estrogen typically. And that makes sense. It's the quote unquote female hormone. It's the hormone that drops really dramatically during menopause. But did you know that progesterone usually drops first? By and large, for most people with ovaries, progesterone will drop long before estrogen does. And during that time, you can have wild fluctuations where estrogen can be quite high, and then it may spontaneously plummet some months. But generally, progesterone is doing a really slow decline. So you very often will have low progesterone and elevated estrogen. During that time, we can still support you, but we need to be thinking about more than just estrogen. This is why it's really important to work with a knowledgeable practitioner so that you can receive the support you need for the stage you're in. And FYI, progesterone docks on GABA receptors. For many women, the increase you may feel in anxiety or sleeplessness is due to low progesterone in perimenopause. Before your period ever stops, you may experience potentially heavier bleeds because you don't have progesterone on board as much to balance out the estrogen, but you will also experience potentially some increase in anxiety and in sleeplessness. And that's usually because progesterone is not there to dock on GABA receptors as it may have done before you entered perimenopause. Number 3, and speaking of estrogen, that's what we typically think about when we think about hormone therapy or hormone replacement therapy or bioidentical hormone therapy, whatever you want to call it, menopausal hormone therapy. We're thinking usually about estrogen. But did you know, in addition to progesterone, which I just mentioned, testosterone is a major player in your symptoms. Testosterone often falls for people with ovaries as well. And, little known fact, you actually produce more testosterone than estrogen. We just tend to make less of it than people born with testes. So if you were born with ovaries, you actually produce more testosterone than you do estrogen. You just make less of it than men or people born with testes. Why does this matter? It matters because if it is really low, and if we have done everything we could do for your estrogen and progesterone, and you're still experiencing really low libido, really weak orgasms or inability to orgasm, mood issues like depression, a lack of motivation, if you're having trouble seeing improvements with weightlifting, testosterone is an option for you, and a qualified practitioner ought to be able to test you and supplement you with testosterone if needed. Number 4, and this one really gets me. You may have been told by a provider that we can't do anything for you for your symptoms until your period stops. And that is simply not true. There are many, many things we can do for you. We can and should support people with ovaries through the perimenopausal transition with appropriate nutrition recommendations, with changes to your fitness routine, with mind-body medicine, and yes, specific hormone therapy. There are plenty of hormone therapy options for people who are still bleeding. And finally, number 5, yes, we can support you with menopausal hormone therapy safely. If you've heard that taking hormones will cause breast cancer, you should know that that is old information and that the conventional medical consensus these days is that women can and should be offered hormone therapy to help with the moderate to severe symptoms of menopause, as the benefits very often outweigh the risks. Additionally, you may have heard of the Women's Health Initiative or the WHI study that was conducted years ago. It really scared a whole generation of physicians and patients away from taking hormone therapy for their symptoms. The products that were used for that study are not the products we use today. And in addition, the participants of the study were much older than most people who would be considered for hormone therapy today. Now, every person is different, and your medical history, your family history should definitely be taken into consideration. Your goals, your symptoms in particular should be taken into consideration. So if you have been told that hormone therapy causes breast cancer, I need you to know that there are many, many options that are very safe. And if you are having symptoms that are disrupting your life, please know that you do not need to suffer. So thanks for listening. I hope this has been informative and helpful. Hopefully you can take this information to your provider and get the support that you need. If I can help you further, if you have any other questions about perimenopause or menopause, or just want to chat with a knowledgeable practitioner, please don't hesitate to reach out. You can find me at draliciagajar.com.